Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. So in today's video, I will be answering the caregiver question, does a dementia diagnosis really matter? There seems to be no meaningful medication or treatment. So I actually get this question quite a bit, and my answer has a few layers to it because it's kind of like a no, but yes. So let's break it down. Now, even though right now there are currently no medications or treatments that can cure true dementia or progressive forms of dementia, we have to be very careful about what we are labeling as meaningful. Is it only meaningful if there is a full reversal of the disease process, or can it also be meaningful to know what's going on enough to treat it in a way that can improve the person's quality of life and ability to function despite their condition? I would say that it's important to consider both, but I know that some people will have varying opinions, okay? Now, with that being said, there are four main reasons why getting a dementia diagnosis would be important. One reason is that it's important not to assume that everything that looks like dementia is dementia, because it may not be. There may be something else going on, like an infection or vitamin deficiencies or hormonal issues or a tumor that could better explain the person's symptoms. But the only way to get a diagnosis is to seek a diagnosis and go through that rule out process that doctors have to go through in order to figure out what's going on with you and give you a proper diagnosis. The second reason is that depending on the type of dementia a person has, the treatment could and may need to look different, especially if medications are going to be involved in the treatment plan. So, for example, people with Lewy body dementia tend to be very sensitive to antipsychotics. They can worsen their symptoms and even be fatal. Also, benzodiazepines and opiates are also typically not recommended for people with Lewy body dementia. But if the type of dementia your person has is not known, it makes it really difficult for the doctor to make sure they're making adequate and safe recommendations. And it also makes it difficult for you as the caregiver to advocate on the behalf of your partner when it comes to things like this, okay? The third reason is that knowing the type of dementia can help you, your family, and your partner living with dementia better plan for the future and know what to expect. Because different types of dementias come with different challenges, different problems, okay? So let's just use Lewy body dementia as an example again. REM sleep behavior disorder, which is basically acting out your dreams while you're sleeping, and insomnia are very characteristic of Lewy body dementia. Parkinsonism, which is characterized by tremors and slowness of movement and rigidity, are characteristic of Lewy body dementia. Now, you may not see those symptoms appear in the early stages of Lewy body dementia, but typically at some point along the disease process, those types of symptoms will appear. Autonomic dysfunction, like regulation of blood pressure. So you might see issues with orthostatic hypotension, which is basically when the person changes position. So let's say from lying down to sitting up or sitting to standing, their blood pressure will drop significantly and they'll start feeling lightheaded and dizzy, and they're at a higher risk for passing out. They may also have a difficult time regulating their body temperature. They may have issues with urinary incontinence and constipation pretty early on. And so these are things that you have to be aware of when it comes to Lewy body dementia. And it's not to say that people with other types of dementia won't experience some of these same issues, but when you know the type of dementia that your person has, it allows you to better deep dive into that type of dementia so that you can know what to expect, what's characteristic of that type of dementia, what's not characteristic of that type of dementia, and what you need to be thinking about to better plan for the future and get things in order, okay? And then the fourth main reason why getting a dementia diagnosis may be important is that depending on your partner's care preferences, if hospice is a desire at the end of life, they will need a diagnosis of a life-limiting illness. Now, this doesn't have to be dementia. This could be cancer, HIV, congestive heart failure, renal failure, Parkinson's, But if they don't have those type of things going on, then having a dementia diagnosis can be really helpful to qualify for hospice. Now, of course, they also have to have an estimated prognosis of 6 months or less left of life, and that can be really hard to predict for dementia if we're being honest, but that's a whole nother topic. But yes, having an official diagnosis of dementia can be really helpful in qualifying for hospice, okay? Now, if you are struggling to get a diagnosis, and maybe the doctors aren't helpful, and it's becoming an exhausting process that seems to be getting you nowhere, and maybe even your partner is tired of going to the doctor and they're like, look, I'm not going anymore. Is it really necessary to get a formal diagnosis? I would say no, not really. And here's why. At the end of the day, we are caring for people, not a diagnosis. Now, can a diagnosis inform care? Yes, but we care for people and we will have to learn how to manage their symptoms as they come. So, if you can't figure out your partner's actual diagnosis because the medical professionals aren't being helpful, or maybe your partner just has a very tricky case, do not stress yourself out about it, okay? Just learn as much as you can about the symptoms and challenges that your partner is displaying. And then, if anything comes up that is concerning, of course, seek medical advice so that you can know the best action to take, okay? But that is all for this video. I hope that it answered your question. If you find information like this helpful, please be sure to like, share, and subscribe. You can also join us inside the treehouse at letsbamboo.com/treehouse, where we have videos, podcasts, blogs, handouts, activities, webinars, all in one convenient location. So we look forward to welcoming you soon, and until next time, bye guys.